Okay, treatments. So what are we going to do to treat your balance disorder or your vertigo or your dizziness? Well, first off, I want to let you know that all of the treatments that we're going to do are going to be specific to the areas of your brain that we find are weak, are not functioning well when we do your examination. So we're going to look at the different aspects. We're going to look at the different lobes of your brain, left and right side, frontal lobe, temporal lobe. We're going to look at the cerebellum, different aspects of the cerebellum, the middle of the cerebellum, which controls a lot of balance and coordination. We're going to check your inner ears. We're going to make sure that you don't have BPPV. We're going to see if there's a otoconia debris that's causing your problem, which we call a peripheral problem. We're going to check your spine. We're going to check your muscle and joint feedback system. We want to make sure that your feet are functioning well. And then what we're going to do is we're going to give you specific treatments based on those areas. The whole goal is to develop what we call neuroplasticity. Now, the word neuroplasticity, if you notice, has plastic in it, and plastic means moldable. And basically what that means is that the brain can change. No matter how old you are, the brain is always changing based on the specific stimulations that are given to it. So if we find an area of your brain is weak, let's say left cerebellum, we'll stimulate the left cerebellum, and we are trying to develop healthy neuroplasticity, which that basically means is we want to get that area stronger, we want to get that area more efficient, we want to develop better synapses in that area. So I always talk about the Charlie Brown Christmas tree, and if you look at it versus a real bushy, healthy Christmas tree, people that have decreased function, it's like their nerves are kind of like the Charlie Brown Christmas tree. They're just not, the electricity is not flowing through those nerves properly. But if we can stimulate them, and we get them functioning better, we can develop healthier, bushier synapses and nerve sprouts and healthier neurotransmitters. That's what we want to do if there's an imbalance on one side versus the other. We're going to get that side up to balance it, and that's going to create more balance in your body. It's going to create less vertigo, and that's the goal. So what are we going to do? Well, the brain needs two things. Your brain needs fuel and it needs activation. Fuel is in the form of glucose, which comes from the nutrition in the food in your metabolism, and it also is in the form of oxygen. Oxygen is fuel for your brain. Your brain needs oxygen. That's why if you have a stroke, you cut off the oxygen supply and your brain tissue dies. One thing before we get into fuel and activation, I talked about how heart lesions like strokes and MS and tumors and things like that are things that can cause dizziness. Well, you should definitely get those things checked out. But let's say you have a stroke, you've had a stroke years ago, and it is maybe the culprit in your dizziness. It doesn't mean that we can't take care of you functionally. It just means that, hey, you need to get that checked out first to find out if you've had that problem. Same thing with MS. Some people have some MS that is undiagnosed, which may be causing some problems also. So what I'm saying is you need to get a thorough neurological exam medically prior to coming in to make sure that if there is a heart lesion, it's taken care of that way. So we can take care of patients with pre-existing heart lesions, or the goal is to find out what type of soft lesion they have. So again, brain needs fuel and it needs stimulation. So the fuel is very important. So we put all of our patients on oxygen therapy. Oxygen therapy, we use this cannula, and what will happen is we'll put them on what's called an oxygen concentrator. And what we'll do is we get them on the oxygen, which is fuel, and we'll provide them with some type of activation. So we may do some left cerebellar exercises, some balance exercises. We may have you do some nonlinear complex movements with that side of your body. We may put you on a UBE, which is like a cycle that you use for your arms. That will stimulate and fire up the brain. So everything that we do here functionally with these patients with balance disorders, we get them on oxygen. The cerebellum, which controls your balance, is the most oxygen-dependent part of your body. So typically over the years, people will undergo what's called oxidative phosphorylation, which means that they won't be able to utilize their oxygen as well, and that can cause some of these decreased areas of function in certain parts of your brain. So oxygen is absolutely critical. We want to provide the brain with fuel and activation. The other thing that we may do is we may do specific types of eye exercises. Let's say we find out that the right side of your brain isn't functioning well, we'll have you do eye exercises where you're moving your eyes to the left. We may do some olfactory stim. We may have you smell different smells to fire up weak areas in your brain. We may do something called a caloric. A warm caloric we'll actually put warm water in this external ear here, which will heat up the endolymph inside the vestibular system, and that sends a message to that side of the cerebellum. So if you've got a weak left cerebellum, we may do a warm caloric on the left side to stimulate that side. We may do vibration on the left side of your body to stimulate the muscle and joint feedback system. Another great way to stimulate the muscle and joint feedback system is with gentle chiropractic adjustments on the side of your body that's not functioning. So if you've got a bad left cerebellum causing your balance disorder, we want to stimulate the left side of your cerebellum. We can do that using, I know some patients would like to have as gentle of care as possible, so we may use an instrument. This is a very light instrument that's just going to put a little light force stimulation on the left side of the spine, and that will stimulate the left side of the brain, left side of the cerebellum. So that's an important thing that we do. Now, a lot of patients that have dizziness also have neck problems. They may have lower back degeneration, bulging and herniated discs. And so to improve the muscle and joint feedback system, we may use something called non-surgical spinal decompression therapy, which is a slow stretch to the discs in your spine. What it does is it takes a slow stretch and it activates these muscle and joint feedback system, which goes up and feeds the brain and really improves the function of the brain. We'll put patients on oxygen while we do spinal decompression therapy. Another type of therapy that we use with patients with balance disorders is the interactive metronome. Now, the interactive metronome is a computer-based program where you're going to wear these headphones, and what you're going to hear is you're going to hear an auditory reference tune or an auditory reference bean, cowbell. It's going to sound like a little bing, bing. It's going to sound like that, and what's going to happen is you're going to have to clap or do a gross motor activity with either your feet or with your hands or with your arms to the beat. And what that develops is it develops timing and it develops coordination between all of these systems here. And that can really enhance somebody and help somebody with balance disorder. So patients, especially people that are having a hard time on their feet, we're going to get them doing things that are going to develop the part of their brain that's going to make them more steady. So that's just a couple of the different treatments. There's probably 100 other treatments that we may do specific to your examination. Now, that's the stimulations. Remember, brain needs fuel and activation. Fuel comes in the form of oxygen. We've talked about that. Absolutely critical for patients with balance disorders and vertigo. The other thing is looking at blood panels and determining how you are doing metabolically. So we send out patients for blood sugar tests. We'll look at their blood sugar panels. We'll look at thyroid function. We'll look at adrenal function. We'll do a complete blood count. We sometimes will send patients out for food sensitivity testing and autoimmune testing. We do special tests for autoimmune function, especially for people with Meniere's disease and this recurrent otoconia debris that occurs in the inner ear, because a lot of times that is due to an autoimmune condition that's attacking the area of your brain that causes you to be stable. So some people are highly allergic to things that they're eating. Gluten sensitivities. They may have an autoimmune reaction to different types of foods, egg, milk, things like that. So we want to really rule out all those issues that may be affecting you metabolically. We look at your blood panels through a preventative medicine, integrated medicine approach, which means that when we look at your blood panels, we really want to make sure that things are as tight as possible. You may not have diabetes, but you may have what's called insulin resistance. So your blood sugars may be not where they need to be, but they're not defined as diabetes. And that could be causing a problem. This high blood sugars may be causing some neuropathies in your feet. You may have adrenals that aren't functioning well. So we want to get you metabolically as healthy as possible, because that's going to develop good fuel for the nerves, so those nerves can develop healthy neuroplasticity, which is going to create balance in these systems, which is going to get you better. And that's why we help people get better who have been to 7, 8 different doctors, have tried everything, because medicine only treats the pathology, which is the hard lesions, and they only treat the inner ear, BPPV. And they typically, when they do that, they don't do any rehabilitation functionally of the nervous system. So if you're suffering with these types of problems, the balance disorders, the vertigos, and you've been to multiple doctors and nobody has an answer for you, everybody's telling you, you're going to have to learn to live with it, take this medication, and you're serious about finding out about a drug-free solution, call our office at 610-518-3370, and we will do a complimentary balance disorder vertigo consultation to determine if you're somebody we can help in the practice. Thanks a lot for listening, and take care.